Good afternoon, ladies and gentlemen. I welcome all of you to come to this webinar. We are start the organization Innovatio Curis is for profit, and Innovatio Curis Foundation Healthcare Excellence is not for profit. We have decided we'll have some knowledge sharing webinar. That's our role as a organization or as a company. Our whole aim is how we can do healthcare delivery costs can be optimized, yet keep the quality. I am managing the affairs of Innovation Curis with other partners like Sachin, Alok, etc. And we have the partnership with the Swecare. Swecare is from the Sweden, and the Swecare partnership we are doing many things. I introduce a Shampa Bari, who is a project manager of Swecare Foundation, and I request Shampa give a out brief of 4 to 5 minutes. What is the Swecare and how you are doing something with us, and what are your intent, etc. Over to Shampa.
Thank you, Dr. Singh. It's been a great collaboration with you over the past few years. We've been working together now almost for 3 years. And it started
Yeah.
off as a collaboration between us through a EU grant that we have received in collaboration with some of the other Baltic nations. And our collaboration with Sachin, who's been a coach for some of our Swedish companies, has been very successful. And I just wanted to thank you for this opportunity. Swecare is a semi-governmental organization that is funded for the large part by the Ministry of Health in Sweden, and for a third of our funding comes from member organizations, of which we have about 100. And Lars, who will be speaking during this webinar, is one represents one of the members, Aleris. And our members really range from startup to bigger companies like Aleris, or even bigger companies like AstraZeneca and Getinge. But the goal of our foundation is to help these companies come to new markets, of which, of course, India is one of the most important ones. And this journey has been very exciting for both me and my colleagues at Swecare, and for the companies, I think, as well. India is fascinating and also scary for, I think, a lot of companies coming in. But what I was very excited about this time when I traveled there with Lars in October was this whole new technology coming out of India, and the technology and the innovation that exists already in Sweden. How can we collaborate together to see how we can build a future together where we can use this technology in order to have better health among our populations. So I'm hoping that this discussion will lead to maybe more questions rather than answers. But the whole point is to have this dialogue and this discussion between people working both on the Swedish side and the Indian side. So that is basically all I had to say. We are planning to come back to India with a delegation end of February, and we'll be working with Innovation Curis on that as well. Currently, we don't have a government in Sweden, so we're waiting for all of that to fall into place before we have more information. So if you are interested in continuing this dialogue in person in Delhi later in the month in February, do get in touch. So thank you so much for this opportunity, Dr. Singh.
Thank you, Shampa. We are grateful to give you the brief of Swecare and our relationship together, what we have done and what we are planning and what we shall do. It has been great feeling to know that some things are happening and more would happen in future. Well, as you are aware that India is now opening up its market. Healthcare is the one which will lots of things would be done in healthcare because there's a big gap from rural technology, innovations, etc. A lot of buzzwords have been used of late. The earlier it started with innovation. Innovation is slightly now older buzzword. Newer things have come like artificial intelligence, the blockchain, the cybersecurity, etc. Well, the healthcare is scene is changing. Earlier, it was all the physically. When I was a medical student, you were more giving to your clinical acumen. Today, the physician doesn't want to even touch you. You just order, say, X-rays, MRIs, CTs, etc. And they are really not going for clinical evidence-based medicine. But however, I think this is the circle which slowly is also would be modified in future, and the technology would help us, should help us, but they should not override us. That's more important. This particular webinar is very important to us because the people who are really of the subject knowledge based leaders. I introduce you Dr. Vidur Mahajan, who will be moderating this session now onwards, and then hand over to me in the last after question answer for concluding remark. Vidur runs a Mahajan Imaging Center, a chain of high-end medical imaging center in northern India, and he also has got at the Mahajan Imaging, he runs a organization called Caring, that is Center for Advanced Research on Imaging, Neurosciences, and Genomics, which aim at bringing cutting-edge product in the artificial intelligence space into clinical practice and helping radiology and genomics companies develop world-class clinical relevant product. He is a medical profession. In addition, he is also an MBA from Watson School of Business. So he's got both the things like me, doctor, as well as the management degree holders. I hand over to Vidur to take it forward as a moderator. And in the last, I'll come to you back again, the participants, for concluding and also share what is the learning session for us. Thank you. Over to Vidur.
Thank you so much, Dr. Singh. It's an absolute honor for me to be moderating this session. This is actually the first webinar I have ever moderated in my life, so I am quite excited about doing this. I think, as we had discussed, I'll start off by just giving a little bit of insight into exactly what we do at Mahajan Imaging and at Caring. I think it would be beneficial for the viewers, especially given the fact that a lot of our work we believe is fairly cutting edge. So just in terms of introduction, as Sir put it very nicely, Mahajan Imaging, it's a chain of high-end medical imaging centers based in New Delhi. This is just a little bit about me. Sir covered it. I'm a strange person. I did my medicine first from Sion Hospital in Mumbai, then went to the Wharton School, did an MBA there with dual majors in finance and healthcare management. I'm driven by implementing technologies that effectively improve access and affordability of healthcare in remotest areas of our country. In about Mahajan Imaging specifically, it was started about 20 to 27 years ago now. It was started by my parents. They introduced MRI into India. Currently, we have 9 centers across Delhi. Five are within large hospitals, including government hospitals, corporate hospitals, charitable hospitals. Four are standalone facilities. We have a team of about 50 radiologists and other nuclear medicine physicians, cardiologists, anesthesiologists, etc., and about 350 other support staff. We are a referral center for complicated cases from across the country. And we have a very special emphasis on training and research and development, which I'll just come to. And we last year we did about 400,000 patients, and we try to maintain that number. This picture, I've just put this here to give a sense that we are not just a radiology company. We also like to have fun while we're at it. So this is our latest center in Gurgaon, where it's probably the first place on the planet where we put grass into the MRI machine. We put plants, we put wooden planks. The whole idea was, because this was the first time we bought a machine from Philips, the whole idea was to recreate the experience of being in the Netherlands inside an MRI room. We also put tulips on the walls and all that. So we like to have fun while we're doing whatever we are doing. So in summary, we are a patient-centric organization, and we strive to provide world-class imaging services to patients across socioeconomic strata at an affordable price point. Moving on, the more exciting the more exciting part is nowadays, especially in my life, is caring. Caring, as Dr. Singh just described, is the Center for Advanced Research in Imaging, Neurosciences, and Genomics. I'm happy to take any and all questions, either either during this webinar or afterwards, on our work. So at Caring, we basically help companies develop clinically relevant products. So what does that mean? That means, if there is a company that wants to develop artificial intelligence based software, say GE wants to make a artificial intelligence algorithm to detect, some abnormality on chest X-rays, they'll come to us. We'll handhold them through the process, help them figure out what problem to solve, what kind of data is required to solve it, and then finally whether the algorithm actually works or not. So within Caring, we've had a bit of success. The first paper published in the Lancet, which is the one of the highest impact factor journals out there, was from India. It was on deep learning algorithms for head CT scans. It's a matter of great pride for our country, and it's a matter of great pride for us that we were part of the study and we were all co-authors. In terms of presentations, we had 18 papers at the Radiology Society of North America conference, with 12 oral presentations and one invited lecture. We have 30 papers at the European Congress of Radiology. Sorry, this is a typo. This should be 2019. And we have 18 oral papers there, out of which 12 are on AI. And we intend to send more than 50 papers to the RSNA next year. We emphasize translational research. So none of the products that we evaluate are developed by us. All the products are developed by experts. And then, since we are clinical people, we help validate whether these products actually work or not. And towards that end, we realize that it has to be a national or a global uh, effort. So we have developed this small platform. It's actually a computer system where one can deploy various AI algorithms and put this computer system into their department, or radiology center or clinic, and get access to these algorithms, and along the way try to figure out whether they are working or not. Next up is genomics. We are actually starting our next generation sequencing lab in 2 weeks or so. uh, what that means is that we will be probably the first place in the world where a MRI machine and a genomic sequencer would be within 5 meters of each other. And the idea is to emphasize clinical genomics, and the idea is also to emphasize, um, can we derive genomic level information from MRI scans and CT scans? So happy to talk on that. And lastly, as I mentioned, we operate purely on a collaborative model. We work with more than 20 collaborators across the world. I've just listed Quibim is a Spanish AI company. Really, really good guys. GE, Philips need no introduction. So I'll stop it at that. And yeah, and then happy to answer any questions. And if not, I think we can move on to Lars's to the actual discussion.
Okay, fine. Lars is a business area manager for Aleris Rongen in Sweden and has been employed since 95, has built the X-ray business since its inception in his company. Aleris is Sweden's largest radiology manufacturers, all categories, and the specialty in the MR, that is magnet camera surveys. There are generally long waiting time for MRI, all the countries, councils of India, and any other information. Lars, you want to add on? Please go ahead.
Yes, can you see the presentation now?
Yeah.
Yeah, good. So first I want to present myself. Yes, I'm I have been working with Aleris Group since '95, as you said. And at that moment, we started on a small hospital in the center of Stockholm with, from the beginning, 0 examination. And until today, we have increased our position in Sweden. And today we do about 500,000 examinations per year. Also, 2 years ago, we bought a company in Norway, about the same culture, also with about 500,000 examinations. So totally in Sweden, Norway, and Denmark, we today do a little bit more than 1 million examinations per year. Can we take slides 2, please, Bara? Yes?
Yeah, you're done.
I just also want to present what does Aleris do within many areas of the healthcare system in Sweden. We have specialist care in many areas, primary care, diagnostic, elderly care, and young and adult care. That most psychiatrists. And we have 11,000 employees and about 450 units. And our annual revenue is about 10 billion Swedish crowns. That's the same as 1 billion euro per year in Sweden and Norway. Then also, of course, we have a long-term commitment to developing the future of the healthcare and care, and also in many places in the world, and also in India. We have a cooperation with some projects also in India. Number 4, slides number 4 here. You can see on the map Sweden, Norway, and Denmark, and our 450 units there. And also the growth of Aleris during the last years, from 2005 until 2016. You can see we had a quite good growth during this year. And then we come to the diagnostic. It's not only X-ray, we have also laboratory medicine and physiology medicine. But our main area is diagnostic in both Sweden and Norway. And as you can see, we have we have 40 units in Sweden within diagnostics. It's 20 X-ray units, 13 in Norway and 6 in Denmark. And what does we provide? From the first, we are by 90%, both in Sweden and Norway, we are a provider within the healthcare system. So there are tenders, usually between 3 and 7 years. They last for 3 to 7 years. And we have agreement with many regions in Sweden and provide radiology then. We have MRI, CT, PET CT, ordinary X-ray, ultrasound, bone density, and mammography we provide. And also, as you can see on the image there is a mobile MRI scanner running around in Sweden, mostly in north of Sweden, where there is a lack of scanners. And also in Sweden, we do about, we have statistic on that, by a population of 1,000 people, we do about 50 MRI scanning per year. In Norway, there is about 120 per 1,000 in population. So Norway really use MR a lot. But totally, we do 360,000 MRI examinations per year in Norway and Sweden. And also then in Oslo in Norway, we have a very good cancer center, a cancer diagnostic center. And the specialty is prostate. And there, I think it's the same over the whole world. But in Sweden, we now are on this stage that the method to detect prostate cancer is first you take a blood test, PSA. After that, we start with an MRI to look how does the prostate looks like, and then after that we do a fusion biopsy. We use the MR image, and then we have that as a guide to do an ultrasound biopsy. So fusion biopsy we do, and after that we choose what kind of therapy is good for just this patient. But that's in Oslo. We also have it in Stockholm, but it's more well known in Oslo. And that's in Oslo. Also, we have the PET CT scanner. Then outside the diagnostic area, we also, of course, have an app, Doctor24, and yeah, that will grow a lot, you know, with digital visit to the doctor. And as you can see here on the next image 10, the growth of these digital visits will grow a lot, 14% per month during the last year. So it will be an enormous growth of this digital visit. And then just at the end, I want to show you the owner of Aleris. Is a Swedish family, Wallenberg. They have company Investor. And Investor is owner of a lot of company, very large company in the world, Atlas Copco, Husqvarna, Electrolux, Ericsson, ABB, and so on, and also Aleris. And it's quite interesting that the profit from all this company together, it will move into the foundation of Wallenberg. And from that foundation, the purpose of the foundation is to support Swedish scientific science and also medical science. So the last year, this foundation have supported with 200 million euro every year to research, scientific research in Sweden. Yeah, I think that's it. Then we can talk a little bit afterwards. Thank you.
Thanks,
Okay.
thanks, Lars. That was really good, and especially I think this last slide just gives you the expanse of the Wallengriff family, how entrenched they are in the healthcare ecosystem. Like they are investors in AstraZeneca. That's just next level, and Electrolux. So of course I think that has become GE now. So so I think before we start getting questions from the audience, so Lars, what do you think what is the one problem in radiology that you anticipate coming up in the next 3 to 5 years, short-term problem that you think is going to come up in radiology in the next 3 to 5 years, and what are you doing to address it?
Yeah, that's quite interesting. There are mostly possibilities, of course, but there are some real huge problem also. And I think over the whole world, there is a very big lack of doctors. In Great Britain, it's enormous. In Sweden, it's quite big. And I think everywhere it is. And that's so interesting when I visited you, Vidur, in New Delhi, that you are you really work with machine learning and artificial intelligence. I was very impressed of that, and I think that is very, very important, and it's very important that we will succeed with that to use the machine, the AI, instead of the doctors, or parallel with the doctors in the future. But that's what I see.
So does that mean that it is actually challenging to find good radiologists in Sweden,
Yes.
Norway,
Over the whole Europe?
Oh, okay. So can you give us, like, how do you deal with that problem?
Still, it's not a so big problem just for Aleris. We have good doctors. We have enough with doctors. Also, we have started a teleradiologic company in Lithuania with they are really good doctors there. We learned them Swedish at the university, and they then started to report. But of course, this machine learning is really that's the solution of that problem in the future. And I think it's better Vidur can talk about that, but I think after already we can use it in small scale, but I think it will take another 5 to 10 years perhaps before we can put a patient into a scanner and ask what's wrong, and the machine will tell us what's wrong. I think it will take perhaps 10 years more. What do you say about that, Vidur?
Lars, I just wanted to know that you have already presented your product and your association with India. What are your plans? What you really wish to do it in next couple of years in India?
Well, we have looking, of course, in of the Indian market, and I think you are growing so strong economically in India, and you really you need more scanners, you need more examination in the future, and also I think you can pay for it very soon. People are going to get it much better. You know, I have been in India. I was traveling in India 40 years ago, I mean, till now. So I have followed India for a quite long while, and yeah, we were looking in India and don't know, and it was so interesting to visit Vidur's unit in New Delhi, and also to see that we work in quite same way. And if you can see the presentation of Vidur, you're doing 400,000 examination. Alir is 500 examination in Sweden, and our main area is MRI. It's the same in India and in Sweden. And yeah, it's interesting for us in this stage now.
Okay, thank you.
Yeah, thank you.
We have a couple of questions, large people want to answer. Will artificial intelligence replace human radiologists?
Yeah, I really believe that. Of course, it will start. It's like the car who will run themselves. The technique is here, but you can't use it still. And I think it will start with artificial intelligence. It will do the first read. The doctor will do the second read. And it will be like that for a while, for a couple of years. But after a while, I think the artificial intelligence will replace doctors more or less, and the doctors will do other things. That's what I believe. But it will be very interesting to Vidur know much more about this, and Vidur also do research about it. So let's see what Vidur will say later.
Okay, and then there's another question.
Yes.
The dawn of an artificial intelligence revolution is upon us. What we learned deploying deep learning at scale for radiology images?
Yeah. What to say, but I think I will leave that into Vidur first, because I think Vidur have come much more further than we have there. So please, can we wait until Vidur will answer on that?
Yeah, I think we have lost Vidur in connection there.
Okay. Sorry.
Okay,
Yeah,
we'll take up another question in the meantime.
But then I can talk a little bit about it after artificial intelligence. But you know, it's not so easy to how will this work in the future, because nowadays in the world there are a lot of small providers working with machine learning, and you must have about the same protocol when you put the data in the computer, and if you change something when you're examining the patient, it's easy for the computer to understand, of course. And you know, how will it be when someone finds a quite good solution with that? They will start to use it. Of course, you must first have a permit to do that, but then it will come better and better and better, and the machine will learn better and better and better all the time. And I think also it will be many big companies will buy a lot of small companies, and then let's see what will happen. I'm not sure about that. Is Vidur with us again?
Okay, then we have another question from Mr. Avinash. Please tell also on possibilities of cognitive computing intelligence for radiology and other medical specialties.
Yes, if you go a little bit outside the main area of the radiology and go to mammography, of course you use X-ray, but it's a little bit not in the center of there. You already use it, not totally, but a bit.
Okay, then we have one more question. It's trend of the value of artificial intelligence in radiology today and tomorrow. How to keep pace with the trend?
Yeah, that's also until now, we have used RIS and PACS and we have digitalized a lot within the radiology, but the healthcare sector doesn't earn something about that. It's a technical company who have taken everything until now, and I don't know how it will be with machine learning. The risk is it will be so expensive to have it. It will cost the same price as a doctor. So the money will go, the value will go out from the healthcare sector out to to other sectors. That's a risk. And how can we, like Vidar do? He have started himself to develop this, and then if it will succeed and it will be very good system, he have it in his organization and can take the value of it to his patients. But until this date, a lot of money go out from the healthcare system out to develop things. But let's see what will happen in this area.
Okay, and then we have another question. What are the challenges in artificial intelligence radiology?
It is like today, you can answer quite good if you have a specific question in a specific organ, like say MRI brain or something. If you're asking for the quantifications of gray and white matter and how it is, then if you have a specific question, the AI already today can answer many of these questions. But to get it put in a patient into a scanner and ask what is wrong and get the computer to describe what he will see and not see and what is relevant and not relevant, that I think will take at least 10 years more. But yeah, so that's a real challenge with this system.
Okay, and then we have one more question. It says, could we automate the diagnosis?
Yeah, I think we can do that. I really think, and I'm about sure of that. But I think it will, as I said, take another 10 years before we can use it really and have tried and tested it. But after my thing is that I believe is that after 10 years from now we can use it automatically without a doctor. Perhaps it will take 15 years, but it will be in that period. We can automate it. Yes.
Okay, and we have another question from Mr. Ravikant. How you think artificial intelligence adding value in pre-operative planning?
I don't know if I don't know if I can answer exactly of your question, but if it, but what I am thinking about with this AI, who will provide it? Who is responsible for it? And it's like a car who can drive itself. Who is responsible if there happen an accident? If it's the provider of the car, is it the driver, or who is it? And this with artificial intelligence, who own the data of it? Will it be the company who provide RIS and PACS system? There is a lot of data, or is it Siemens, Philips, GE, and this Japanese company who do provide the scanner? And who will have the responsibility for it? And when it do something wrong? And also, must it still be doctors who will have the second reading of it? I don't know, and let's see how long time it will take. But I'm sure that after a while, as I said before, 10, 15 years, the machine will do it itself without doctor.
Okay, that's a nice. Another question is, can you share main challenges of European radiologists in current scenario?
If I can.
Can you share main challenges of European radiologists in current scenario?
With the radiologist, it different in different countries, but in Sweden, radiologists have and still have a quite strong position. And what will happen with them? Well, it's a really big lack of radiologists, and I think they are still needed. We must check the AI. We must do a lot of things. We have impact of what will we do? What kind of examination will be done, and all these things. And I think the radiologist still will have a quite position beside the computer.
Okay, we have one more question here for Lars. Trend of the value of artificial intelligence in radiology today and tomorrow.
The value of it today and tomorrow?
Yeah.
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 Yeah. Here in Europe, the value is that you can provide radiology in that amount that you want to do, because now it is that big lack of doctors. So that's a real value. Also, hopefully, it will be cheaper. I'm not sure, but hopefully it will be cheaper. And that, of course, very good. Then we can use the more advanced method. We can use more PET scan, more MRI, and less X-ray, and much better diagnostic then. So the society, if there will be an economical value, can use better methods and better modalities. That's a great value now, and especially in the future then, of course.
Okay, then there's another question. How does Alaris integrate new technologies into its work stream? Is it easier as a private provider?
Integrate machine learning and artificial intelligence.
Yeah.
We do not, because in Sweden there is a lot of regulations. We are not allowed to do it at this time. It must be already the agreement we have with the regions in Sweden and with the insurance company and like that. We must double read all examination. So 2 doctors must look at all images, and of course that's one of the reasons it's a lack of doctors, because 2 must do it. And then if we also will work with machine learning, there are 3 functions who have to look at the images, and it's difficult, and it's a lot of regulations with the secretess and everything like that. So it's really hard to work with it. No one do it in Sweden. It is the provider of. We have a company, Sectra. They quite good company to produce Reese and Paxi, and they work with it. And but I think in China and India you work much more and you do in Europe and especially in Sweden.
Hi everyone. Vidur here. I'm back. We talk about all this artificial intelligence, deep learning, machine learning, and then the internet fails, and everything just falls apart. So I'm really sorry about that. I think there were some questions on AI, and given our experience of working at Caring, I'm happy to take those questions.
Nice, you're back, Vidur.
Yes. So I think there was last when we were just starting to talk, there were some questions about what are applications for AI in radiology, and how they can specifically address the shortage of radiologists, global shortage of radiologists. A couple of things that we are working on, which we find a lot of promise in. The first is chest X-rays. About 60 to 70% of all chest X-rays done across the world are probably normal. I think, Lars, even in your imaging centers, most of the scans would be normal. Especially, there are 2 categories of chest X-rays which are almost always normal. The first is a PHC, so a preventive health check kind of chest X-ray. So before joining many companies or for visa issues, a chest X-ray is typically done. Most of them are normal. And then the second such category is a pre-anesthesia checkup. So before going into any surgery, the anesthesiologist typically asks for a chest X-ray. So my point is that if there can be an algorithm which can automatically identify normal chest X-rays from from abnormal chest X-rays, I think that in itself would be a great starting point, because you would save a lot of time and effort that is typically spent analyzing these normal scans. And interestingly enough, about a month ago, we deployed one such algorithm for a validation study, a prospective validation study in two of our imaging centers here in Delhi. And what happens is that every chest X-ray that is acquired, so these are both outpatient facilities, so every chest X-ray that is acquired is automatically read by the AI. And then if it's a normal chest X-ray, the report is automatically populated in our RIS, and that's the normal reporting format. And the cool thing about that is that if the radiologist still, because it's still under validation, the radiologist still has to mark out whether still has to look at the image and still create a report. But what we can do with that is, as soon as they change the standard format that we had put the report in, uh, we get a notification saying that, so and so Mr. Singh's X-ray has been changed by the radiologist. So please see why the algorithm went wrong in that. Uh, so um, those are the kind of implementations that we feel will be very beneficial. We've now analyzed close to about 1,000 X-rays in this format. And we've got, I think, only some 6 false negatives. This is an algorithm by Cure.ai, the company based in Mumbai. So that's just a very cool example of how AI can save real money and save real time. Another thing that we are working on right now, Lars, and given that you do a lot of MRI, would be is normal abnormal brain MRI, right? More than half of brain MRIs are normal.
Yeah.
Do you really need uh, you know a radiologist to look at all the normal ones? Can a AI with very high negative predictive value? So what that means is that if the AI says it's normal, it better be normal. And then the AI doesn't comment on the others. So it's not like the AI is biasing the radiologist or the technologist by saying that, oh, there is an abnormality in this scan, because we can control what the radiologist sees. So those are the kind of things that that I see immediate value in. Yeah, so I'll pause there in case there are any other questions that are there. But
Yes, Dr.
that's just
Vidu, we
how
have one
immediately
question
these
for
can
you.
come up.
Dr. Vidu, we have one question for you.
Yep.
What are your thoughts on potential to use ML on tuberculosis in India at the moment?
No, so ML for TB detection using chest X-ray is amazing, right? It is TB is one of the banes of our country. It renders a lot of people, disables a lot of people. It spreads very fast. It's a function of overpopulation, overcrowding, and all that. There are companies, including Cure.ai, trying to create algorithms to automatically detect TB in chest X-rays using machine learning. The problem with that is very interesting. Let's say there is a chest X-ray. A radiologist looks at the chest X-ray, or let's look at the patient. Right, there is a patient who has been coughing for 2 months. He goes to a physician, and the physician says, "Arey, do two things. One, you get a chest X-ray done, and second, you get a sputum gene expert done." Gene expert is a test which is like the gold standard test for tuberculosis. It is done on sputum, so on the actual cough of the patient. So this patient, he goes to say some imaging center, gets a chest X-ray done, and then he goes to a path lab, gets his sputum test done, and the chest X-ray is looked at by the radiologist. Two things can happen. The radiologist can either find something abnormal and he can say, maybe there is tuberculosis, or the radiologist can say there is nothing abnormal and this is a normal scan. Now, on the other hand, the sputum test can also be positive or negative. So there is actually a scenario there where the chest X-ray might appear to be normal, but the sputum test came out to be positive. Now that presents a very unique problem. These AI companies, when they train their algorithms, they claim that they are using chest X-rays with corresponding sputum test as ground truth. So what that means is that the chest X-ray might actually be normal for you and me. So it might actually be normal for a radiologist or a human being, but the patient actually has TB. Now, when you go out and you try to validate that algorithm, there might be a situation where a normal X-ray is labeled as tuberculosis by the algorithm. And you speak to the AI company, they'll say, yeah, you can only confirm if you do a gene expert on this patient. Why? Because our algorithm was trained on gene expert data, not on human inference. So it's a very interesting thing. So while in theory it's a great tool and it's a great use case, it really needs to be validated, because you don't want people to unnecessarily be spending. Gene expert is not a cheap test. It costs some 2, 3, 4,000 rupees, which Lars would be roughly about 30, 40 euros, which in India is a lot of money. So, what if there are a lot of false positives with respect to the algorithm, and then a lot of people end up getting their scans, their sputum test done? So we are working on validating these algorithms on a few thousand data sets, and only then can you define the constraints. So I know,
Vidur,
long
can I
answer to a
interrupt?
short question.
Sorry, Vidur, if I can
Uh,
interrupt for 1 second, it's Shampa from SweetCare. Just to say
Yep.
that we have a company called MP Diagnostics that's entering or launching in the
Yep.
Indian market next
Yep.
year that Sachin has been coaching, and they are
Yep.
building a Nespresso style small unit that to test for TB, exact strains of TB, which will be much cheaper than the current tests. Just for
Yes,
information.
correct. In fact, I met them at the conference, and that would be amazing, right? If I think the whole lab on a chip concept and I think they go ahead and even estimate the resistance to drugs. Is it a MDR-TB or XDR-TB? So that is again next level. But then price becomes a defining factor, right? TB is typically a disease of the relatively lower socioeconomic rungs, and while for us lot, these tests are easy to afford at a mass level, but they have a great product, and I
I
hope
think
it works.
I think the point is to
yeah,
make it as cheap as possible.
Awesome.
yeah, yeah,
That would be great.
yeah. I just wanted to add here. Uh, Before person gets into clinical stage or X-ray positive, the government of India is very keen to detect all preclinical cases, because by then, when they become clinical, they have already infected around 32 odd people, and it is possible. Now the technology is available, but I want technology of 100 rupees, not of 3,000 or 2,000, etc. And the DBT and DST, they are ready to fund it. They have funded some of the things, and that will be great that you can do the survey, because that could be affordable to the government. Okay. Can
Yes.
we, I think, any other thing can I take on as a concluding remark now? Because there are only 3, 4 minutes left.
Yes, sir, we can do that,
Yes,
sir.
sir, please. Yep.
Okay, okay. Yeah, I am grateful to the experts, Vidur, Lars, and all the people who are organizing it, and all the people who have interesting questions, and to learn from each other, and all attendees. This is a great day. I have learned myself something new into that. I am from the era of a medical school when only X-ray was available. That was when I got into the medical college in 1963. And ultimately, when first MRI came to India, this was a big building with the helium balloons, etc. That it was something very precious item, but it needed almost more than 1,000 square yards constructed area, and the defense has bought it. So from there, now I'm really thinking that how we have come all the way talking of AI, machine learning, etc. The robots have come. Will doctor will become irrelevant? As per the Khosla billionaire fellow from the US says, my computer can do everything, I don't need a doctor. I think doctor shall remain relevant always and ever. I don't think. That is different. The younger people are more interested. Even the number of doctors I've met, they become IT savvy. They are looking into artificial intelligence because IT fellows work only 5 days a week and doctor works 24/7. And I think the Vidur is one example. He's turning doctor into technologist, to IT, to artificial intelligence, etc. And that's more pay, by the way. Doctor is very poorly paid. And so there would be, I'm going to infer two things from it, that in days to come, people are not opting for the medicines as much as other sectors. It's less pay, more headache, more risky. If you don't do well, people sue you for billions of dollars, and then also you are beaten up in India. So there is something which need to be done. But side by side, we also have to see more technology, more problem, ransomwares, cyber security, all these things will come when you are in internet phase, etc. And I also wanted to mention there is some very small thing which people are talking, that many times patient coming from the background like a rural in India, 70%, they come to such buildings and hospital, they get scared. They're really not keen to come. That they feel, what is these machines? Even an MRI, most of the MRI today in India, barring few, the newer generation, many people can't get the MRI done. They have to be sedated, etc., unless they have newer machines which are coming much, much better. So there is requirement of humanizing the medical care also. And many doctors are not taking a profession called gynecologists and surgery, etc., because they have to be on toes, everything. So anyway, we are all in India in the economy of bullock cart going up to the space. All that is there. You can find the transformation and transitions in this. So I am thankful to once again and good learning that we will evolve in the radiology for the better human being, early diagnosis, and most important is at optimization of the cost, which we can afford. Thank you very much.
And thank you for giving me opportunity to enjoy this meeting. It's very interesting for me. Thank you very much.
Thank you.
Okay,
Thank you,
Shampa.
everyone.
Bye. Vidur, Shampa, thank
Bye,
you.
sir. Thank you so much.
So much. Looking
Bye.
forward to seeing you soon. Bye bye.